Hello, this is Don Chum, and I want to welcome you to the Oticon podcast program. In this edition of the podcast program, we are going to talk about the effects on speech understanding that come about as the result of sensorineural hearing loss. One of the core tenets of our brain hearing approach to creating solutions is that speech understanding is a cognitive process. It happens in the brain. The peripheral auditory system's job is to take acoustic input that is around the listener and turn it into a neural code and then send it up to the brain in order to create meaning for the person. It is vital that the neural code that the peripheral auditory system creates is a faithful representation of the soundscape that is around the listener at that moment in time. It is especially important that key speech signals are encoded to the highest degree of accuracy as possible. The neural code coming up from the periphery is not sufficient for speech understanding. The cognitive system has to take that coded information and create meaning out of it. And in order to create meaning out of a speech signal, the cognitive system has to tap into a whole lot of different stored sources of knowledge about what spoken language is all about, knowledge about the situation, knowledge about what the talker was talking about, knowledge about the context of why the conversation is taking place. And the cognitive system is extremely effective at being able to rapidly take this acoustic signal that's been coded and turn it into something that's meaningful to the listener. But in order to do that, it has to have at least a reasonable start on what that information is. That code has to tell enough about the acoustic signal coming in that it is automatically identified as particular phonemes and words. When it cannot automatically be identified, then the cognitive system has to work harder and harder to try to piece together the information that should be coming up from the periphery. And the harder that the cognitive system has to work to try to piece together the information, overall, the harder the listening task is going to be. Of course, for the patient with hearing loss who's not wearing amplification, part of the signal simply is not there. It's missing. It's inaudible to the patient. So that part of the code doesn't even exist. And that's the part of the code that's easily solved by putting amplification on the patient. However, the other big aspect of sensorineural hearing loss is the distortional aspect of the hearing loss. And that means that information that's even above threshold isn't necessarily clearly encoded in the peripheral auditory system. A variety of different psychoacoustic abnormalities, poor frequency resolution, poor temporal resolution, loudness distortions, for example, can create the situation where the signal is just simply not faithfully encoded as a representation of the sound that's coming into the system. When we fit amplification on patients, we do not change their hearing. The hearing that the patient has when they come into the process is the hearing that they have when they exit the process. What we do when we fit amplification is change sound in such a way to allow the patient, with the hearing that they have, to get the most use out of that signal. Oftentimes we think that somehow that we're changing the way the auditory system is working, and that's simply not the case. We definitely change how useful a patient's hearing is to them, how well they can function with the hearing that they have, but the way that they hear sound does not change. And the reason I bring this up is because it's important for us to always remember that the patient is using a damaged, distorted system when they are hearing through amplification. The job of amplification then is to do whatever manipulations are possible to the incoming sound to allow the brain to be able to get the most use out of that signal after it passes through the peripheral auditory system. We can't change what the peripheral auditory system is going to do to the signal, but hopefully we can process the signal in such a way that after that damage or distortion takes place to the signal, the brain still has a fighting chance to put together the information in the signal to allow the patient to understand what is being said. As part of our brain hearing approach to creating solutions for patients then, we are always focused on creating the sort of technologies that allow a patient to get the most use out of the hearing that they have, under the understanding that it is going to be a damaged system, but that system still has a tremendous amount of capability to provide the listener some level of understanding of the speech that's being spoken around them. As always, if you have any questions or comments, feel free to reach out to me. My email is d.shum@oticon.com. Thank you for your time and have a very nice day.